Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we review topics that relate to nutrition, prevention, integrative medicine, and we explore that for the individual and also for society and the world. So today I wanted to go over COVID long haul, some clinical pearls, and I've had some experience treating COVID long haul since I started treating COVID with repurposed drugs and nutraceuticals and other approaches in August of 2021 after I got COVID and after I'd been studying it for a while. And then that led to treating COVID with different therapies. And then obviously, when people start to recover, you have to get them out of that. And you discovered a thing called long haul, usually a group of symptoms that hang on for more than a month. And I like to categorize them in three separate areas. And I'm amazed at how accurate uh, individuals are at describing these. So I'll ask a patient, your 100% health was the week prior to COVID. So as far as your energy, fatigue, that was 100%, even though it might not always been that. Where are you now? And they might say, oh, I'm 60%. And then I will go strength and stamina, which is different than fatigue. And so they will say, yeah, I got pretty good, my energy is pretty good, but I poop out really fast. So strength and stamina, again, before, pre-COVID, and then now. And they might say, and usually, to be truthful, fatigue and strength and stamina kind of go together. They're usually pretty close. So they might say 50% again. And then I'll ask brain fog, cognition, mental clarity. And that can be the same or it can be totally different. I've had people that say my fatigue and my strength and stamina is 25, 30%, but my brain fog and mental clarity is 90, or it could be the reverse. So those are my three very important questions. And I ask those every time I see the patient on follow-up, whether it be a week, whether it be 1 month, whether it be 6 months. So the 100%, even though you might not have perfect energy, strength, and stamina and mental clarity before COVID, that's your 100%. And I find that to be incredibly, incredibly accurate. So those are three of my favorite questions because it helps me monitor, because there's lots of testing you can do. And then whenever I see a patient with long haul, I also check for the things that I would normally check for in any patient that can contribute to what I call spokes on the wheel. We have many spokes to our health on our wheel. And as a wheel turns real smoothly, well, that's good health. But we may end up loosening or tightening or breaking 4 or 5 spokes. And so what you have to do is you have to retighten those spokes to get good health. So while you can focus on therapies for long haul and post COVID treatment, which I'll go into, you also have to look at the person's underlying health before that. Okay, and so that's very important. And sometimes I'll go through history of each decade in an individual's life before I even start talking about COVID. I want to know what their health was, what set them up for COVID to push them over the top. For example, if they had lots of antibiotic therapy when they were younger, or challenges like that where the gut flora would be altered. Environmental exposures, whether it could be for mold or heavy metals or something like that. I look for that. I look for their general health. Are they overweight? Are they physically fit? So I do a history, and people might say, well, why don't you just get into long COVID treatments? Because it's not one bullet point magic. You have to try and repair the whole, tighten as many spokes as you can, and then come in with the specific therapies for long haul. I'm going to ask about diet. Are you eating the common foods? I'm going to have you go off dairy, wheat, and probably eggs for at least a month. Sometimes eggs aren't a bad food, but people are overeating them now, and many people are sensitive. So if you're having 2 or 3 eggs a day, that could be a problem. But dairy and wheat are the biggies. And then I'm going to, processed sugars. You got to stay off processed sugars and processed carbohydrates. So it's this whole thing, make America healthy again, and not eating ultra processed foods. It's very simple. Eat like you were at a farmer's market. So ask about those things. So food intolerance, I talked about dairy, wheat, and eggs, sugar, alcohol. Again, somebody's trying to recover from COVID, they're having a few pops every night. That's probably not the best thing in the world. So we go over diet, general fitness, as I talked about, exercise. Were there exercises before or after COVID? Um, Almost everybody, you want to make sure what was their nutritional status beforehand, especially vitamin D as in David. So that's always an assessment. And then I use frequently the frequent therapies I use for long haul COVID, aside from balancing that like I would a normal patient, would be ivermectin. And sometimes I'll use when somebody has an infection now, even though the infections aren't putting people in the hospital, if I think they're going to have a potential for a long haul, I might keep them on ivermectin for 2 to 4 weeks to knock that load down. So ivermectin's a treatment for long haul. Low dose naltrexone is a common treatment for long haul. IV vitamin C uh, with multivitamins and minerals in it is a part of a treatment protocol. Then there's other IVs, but those that's the one I use the most. Adrenal support, some kind of adrenal support. So I've gone from during COVID, I used a lot of prednisone, low dose, and tapered it over a month. Before that, in my earlier years, I used the low dose cortisone acetate or hydrocortef. That is 1/5 the potency of prednisone, but it helps support the adrenal glands. Or we have different glandular products and herbs that help support the adrenal glands. But everybody probably that has long COVID needs some kind of adrenal support. And sometimes I'll use a combination of them. So adrenal support. Then though post-exercise fatigue is an issue in long COVID, I get people up moving. You got to get walking. So you have to listen to yourself, but you want to try and move every single day. And then we build up. And the same with strength training too. So those are some of my basics. Now in this Substack, what I did was that you'll see in the outline below is that I went into Chat GPT and I wrote down every parameter I could think of in an organized way of how I would approach long haul COVID. And then I put it in there and it came out with a printout. It's about 6 or 7 pages. So I put that in my Substack and then I went through it because you just don't want a bunch of words. I went through it and edited out what I thought was good or reasonable, or I wanted to put something else in there. So it's my original twist of an outline plus I went through the specifics, and I think you'll find it very helpful. So there's lots of hope for long haul COVID, but first you have to look at the patient as an individual, their individual health. I call it spokes on a wheel. Okay. And you look at what it would be out of balance in a normal patient. And then you have your specifics that are more specific to COVID, but you've got to balance those other spokes as well. So you might balance 5 or 6 normal spokes, which could be from hormones to environmental toxins to nutritional deficiencies, and then add in the little things I talked about, whether it be ivermectin or low dose naltrexone or IV vitamin C, um, spike protein detox, which is, I forgot to mention that, always evaluate for spike protein antibodies in long haul COVID patients, the IgG quantitative. There's a number there that they give you, and if you can help reduce that, and normally you see that after vaccine injury more, but still I check for it in long COVID. So there's lots of hope for long COVID. You can go to the Substack. I'll have the link and you can go there and it's typed out in quite some detail. My name is Kirk Hamilton. I'm a physician assistant. I've been practicing integrative medicine for 43 years and don't know everything, but have learned a lot through going from my own personal health issues and also from seeing lots and lots of patients and studying a lot. Talk to you soon. You have a great day.